So this is quite possibly the most common exercise we'll see for extension of the back, but it's probably the least effective for maintaining the motion that you get with it. So roller goes underneath the thoracic spine. From here, most people will either keep their arms tucked and just rest over it. They may open up. Remember that if you open up, you're probably going to run into some latissimus limitations in the motion, so just keep that in mind. Latissimus may be something that you want to work on, but just note that the more you bring your arms up, more latissimus is going to kick in versus just trying to get a little bit more motion in that thoracic region itself. Now, the reason why this is a little bit problematic is a lot of people will just sit there and lie, and then after a while they get up and they don't actually use the range of motion that they just worked to get, and it just reverts back. So ask the person to find a spot. Once they find the spot, really opening up. If they can, do some chin tucks there, which if you feel that chin tuck occur, you'll feel the muscles in the back extending over that roller or bolster to help use that range of motion that the person's getting. Now, this should not cause pain, so if it causes pain, probably not wise to use that set. What you would do instead is ask them to then flip over onto their stomach and either arms out, remember latissimus and how you need to account for that, or by their side, and then lifting up to use that newly gained range of motion.